Hello, everybody. I'm Dr. Ron Israeli, and as many of you may already know, I'm a plastic surgeon specializing in post-mastectomy breast reconstruction. I'm also on the advisory board of the Adelphi, New York statewide breast cancer hotline and support program, and I am very happy to be here today with Lois Goetz. Lois is a bilingual social worker at the Adelphi Breast Cancer Program, and she works as an advocate for underserved women diagnosed with breast cancer. So, Lois, maybe we'll start. You can kind of tell us a little bit about what you do with the program.
Of course. Thank you, Dr. Israeli. In addition to offering emotional support to patients and their families, I help patients to understand their treatment options, and I assist them in navigating the healthcare system. My goal is to assess each patient's needs and ensure that any barriers to treatment are overcome.
What kind of barriers, the patients that you see, I know they're underserved, so what kind of barriers are we talking about here?
These barriers include food insecurity, housing, legal challenges, as well as insurance ineligibility.
Yeah, so that's really navigating the health system for patients that are given a difficult diagnosis, going through a very hard time, and I think it's really tremendously helpful. And it's not only at the time of the initial diagnosis, the initial shock, but also throughout the treatment process. I know that you participate in continuing to help patients during the treatment, even beyond. In fact, it's a similar experience that I have in my practice, and that starts at the time of diagnosis. When I talk about the time of early diagnosis, I think that it's very important from my perspective as a surgeon doing breast reconstruction. It's critical for patients to understand all of their options, all their breast cancer treatment options and their breast reconstruction options early on. And in fact, if they know that reconstruction is an option for them, in many cases, that might even help, shall we say, ease the shock of that initial diagnosis.
I certainly agree with that, and I've observed that often women will express relief after they speak with the plastic surgeon regarding their options. When I speak with women facing mastectomy, I make sure to let each woman know that she has the right to choose whether she wishes to have reconstruction, and if so, what type and when. In fact, New York state law mandates that women facing mastectomies be informed of their reconstruction options.
That's right. And that, Lois, that starts with the breast surgeon. So when a breast surgeon is talking to a patient and talks to them about their treatment options, and they say, well, mastectomy is an option for you, they, at that point, need to also let them know that, in fact, if we're talking about mastectomy, you have a choice. And breast reconstruction is also an option.
Absolutely. Yeah. I also make sure women are asking the right questions.
That's right.
And then I try to help them answer those questions. For example, should I have reconstruction?
Yeah.
If a woman chooses not to have reconstruction, or if she decides to delay it, I make her aware that she can use a prosthesis or breast form that fits into a bra. Alternatively, if she likes, there are post-mastectomy bras that have built-in breast forms. On the other hand, if a woman chooses to have reconstruction, she may ask, when should I have reconstruction? Or if I delay it, will it be an option for me later? What will it mean? And of course, she will ask, which option is best for me and why?
Yeah, no, that's right, Lois. I mean, that's where I come in, which option is best for me. And I think that every woman has a choice. And also every woman is different. And because each woman is different, there are many factors that go into deciding what's best for each patient. So what I tell patients when they first come in to see me, even before I examine them, before I determine which is best for them, we just kind of talk about the general options. And there are really two categories, if you will, of breast reconstruction. You can use breast implants for a breast reconstruction, or you can use the woman's own natural tissue from her body to reconstruct the breast. When we take natural tissue from one part of the body and transfer it to the breast to reconstruct the breast, we call that a flap of tissue. And in some cases, we might even combine a flap of tissue with an implant. In cases where we just use an implant for the reconstruction, there are also options, right? We might either go directly to an implant for the reconstruction at the time of mastectomy, or we may choose to go with a staged approach. Similarly, with the flap reconstruction, that could be done at the time of the mastectomy, or that can be done at a later date. So I sort of see my role in the initial consultation is to make sure that my patients, that they're fully informed regarding their options, that they understand the risks, the benefits of the surgery and the choices. And I make sure to talk to them about the staged nature of breast reconstruction so that they can understand the timing between procedures, the timing of recovery for each surgery, so that they can plan ahead. And this is critical because they'll need to know what they need to do as far as care at home is concerned after surgery. So basically, I want to make sure all their questions are answered. That's basically what we want to do in that initial consultation.
Yes, and it is so critical to have informed patients.
Yeah.
In our multicultural society, it's very important that patients receive information in their own language, and they have the right to receive it in their own language. Language translation services are available at all facilities, and patients don't always realize that this right is theirs. Patients need to ask questions, and they need to receive answers that are in their language. For women who are worried that insurance might not cover the cost of reconstruction,
which is a real thing, because patients say, I'm getting breast implants. Does insurance covers that?
Absolutely. This is one of their main preoccupations. How will I pay for all of this?
Yeah.
I try to educate them about the Women's Health and Cancer Act of 1998,
yes,
which is a federal law that mandates insurance coverage for post-mastectomy breast reconstruction. This includes coverage for surgery on the opposite breast, which many women are unaware of.
Right. That law covers or mandates insurance coverage regardless of the number of stages of surgery.
And for those women who don't want reconstruction, the law mandates coverage for a breast prosthesis. Last but not least, social workers can assist patients who are uninsured to apply for financial assistance, so that they can cover the cost of bras and prostheses.
Right. So that's a very important piece of information for patients to know. I couldn't agree with you more about our ability to inform patients, or the importance of informing patients in the language that's comfortable for them, so that they understand and can ask the questions and have answers to the questions that they have. I think, Lois, that we were able to, in this sort of summary, cover a lot of ground as far as patients' rights are concerned regarding cancer treatments and breast reconstruction, as well as touch on a little bit on the options for reconstruction. So I want to thank you for sharing your thoughts with us today.
You're very welcome, and thank you for joining us as well.
Yes, and I also want to thank the Plastic Surgery Foundation, which has provided a grant helping the mission of the Adelphi Breast Cancer Program and helping create educational material like this conversation and this video that we created today. Thanks very much. Everybody stay healthy, stay safe.